Hello and welcome to this webinar to describe what this is all about, your health, your well-being and your numbers. So my name is Helen Donovan. I'm one of the associates in nursing working for C3. A little bit more about C3 in a minute. But this is really just an introduction to what this is all about. And I've been working with another associate in nursing, Lola Kahendi, who's not here with me today. So sit back, enjoy the next sort of 5 or 10 minutes. I'm just going to describe to you what this is all about and hopefully give you some motivation, some insight into how we can all improve our own health, well-being and understand what the numbers that we talk about are all about. So, what is C3? C3 is C3 Collaborating for Health, and the vision of C3 is to have a world where no one dies from preventable chronic diseases, sometimes referred to as non-communicable diseases. What are non-communicable diseases, I might hear you ask? Well, essentially, they're diseases that you can't catch. They're not like flu, they're not like other infections, but they're more things like diabetes or heart or respiratory diseases, and of course, some cancers. Now, some of the causes are family, genetics, but most of it's actually down to the way we live our lives. And a lot of that can be preventable. We can change the way we live. We can improve what we eat and what we drink, not smoke, for example, have more rest, relaxation, and look after ourselves better. And that will all help us to be healthier. So the mission of C3 is we're a global organisation, so we work across our different countries, but bringing together communities from across different sectors to help to create those changes in our societies that make it easier for people to improve the way they eat, what their diet consists of. Stop them drinking harmful amounts of alcohol, stopping smoking. Of course, we all know that smoking never does any harm and any good at all. Increasing the levels of physical activity. Now, you notice I'm not talking about exercise because I know sometimes people feel a bit anxious about that. We're talking about increasing the overall physical activity that we have in our day and improving our overall well-being. So this is all really important for us. So why is prevention important? So we consider there's 3 key risk factors. Tobacco use, I've mentioned, there's never an indication. So smoking is always going to be bad for us. Lack of physical activity, sedentary roles. How can we improve the amount of physical activity we can do? And of course, what we eat and drink. Now, those 3 things all contribute to essentially four chronic diseases, and we've put them here on the slide for you: cardiovascular disease, type 2 diabetes, cancers, and of course chronic lung disease. Now, the World Health Organization reckoned that about 70% of these diseases, and some estimates are higher, could be reduced if we looked after ourselves better. We take better note of the things that we eat, drink and do or not do. So what's this all about? Your health, your well-being and your numbers. So C3, I've just explained, we're an organisation, global organisation, but we've teamed up with the NHS North Central London Integrated Care Board. We've teamed up with this organisation called Wellbeing People, and we've sought funding from the Burdett Trust for Nursing to put together this project, working with social care settings. This is staff working in the social care, adult social care settings. So whether you're in care homes, whether you're in nursing homes, we know that you work really hard, very often for very little pay, and life is busy. So how can you better look after yourself? So we put together a suite of resources, and I've put the screenshot of the web page that we've put together, and you can look at that whenever you want to. And with the Wellbeing People, We're going into care homes, care settings, and with a kiosk. The health kiosk will provide you with free health MOTs, if you like, which will give you a health check. It'll monitor your blood pressure, your weight, look at how much fluid you're drinking, your body fat percentages. And we're also offering, as part of that, the Habits for Health program, which comes from Wellbeing People, and you can sign up to it today by scanning that QR code on your screen. So I'm going to give you a couple of minutes to do that, so you can get your cameras out, scan that QR code. The QR code is also available on the website for you. As I say, it's free. You can do it in your own time. It'll take you through different ideas, different thoughts, how you can better look after yourself. And we would really urge you to have a go, have a look at it. And I'm going to go through some of the tips with you over the next few webinars. But that's what it's all about. That's what this project is hopefully going to give you. And Habits for Health is a key part of it. So do sign up today, scan that QR code on the slide, and have a go, see what it's all about. So I'm just going to move on from that, because the other thing that we've noticed with working with people from different sectors is, and most of us do want to do the right thing. We want to be healthier. And very often we'll go online, we'll go into various search engines such as Google and others, and try and work out what it is that we can do, how we can be healthier. But of course, there's so much information out there, isn't it? It can be really a minefield. What's fake news out there? It can feel a little bit like a detective in a crime story, trying to work out how things fit together. So finding and trusting information and evidence, there's so much noise out there. Now, it's really difficult to know exactly what to do. But what I would really urge you is, when you're looking for answers, always be curious. Where does the information come from? Is there a date associated with it? Does it look professional? If it's just AI generated information that comes up when you put in a question into a search engine, maybe delve down a little bit. Where is that information actually coming from? And is it trying to sell you something? When you go onto lots of websites, you'll see either there'll be adverts popping up all the time, or if you're on a computer, you'll see on the right-hand side of the screen loads of adverts and information. So where is it coming from? Is it reputable? Is it professional? You'll notice that NHS websites, our own C3 website, doesn't have that, because that's all that we're trying to give you. We're just trying to give you that information. Not saying that websites that have that are necessarily wrong, but just be curious about it. Are there references? Is there sort of some evidence to back up what's being said? And our other organisations, if you can look out for the NHS sign on things, but also other organisations that you know to be reputable, such as maybe the World Health Organization. And I've put here, this is the PIF tick, and this has come from the Patient Information Forum. And they work with organisations to make sure that the information is sound and reputable. And once they're happy, they will award that organisation what they call the PIF tick. And you'll see that in things like the Parkinson's Association, the British Heart Foundation, Self Care Forum have all been awarded this PIF tick. So you can be assured that the information that you're looking at is sound and reputable. So that's a little starter for 10. And just to finish off, it's all about taking time for you very often. There you are, busy looking after all the other people in your care setting, often family, dependents, children, other relatives at home maybe. So take time for you. This is a very simple breathing exercise, and I often like to teach it by holding my hand on my chest and maybe my other hand on my abdomen, and it goes in a box. That's why it's called the box breathing cycle. And essentially, you breathe in for a count of 4, you hold the top of the breath for a count of 4, and then you breathe out for a count of 4, and then you hold for a count of 4 for the bottom of the breath. So I'm just going to let you try it. In for a count of 4, 3, 4, hold for a count of 4, 2, 3, 4. Breathe out for a count of 4, 2, 3, 4, and hold for a count of 4. Just do that for a little while. Look after yourself. And I think you can almost feel your blood pressure dropping while you're doing that. And just try to do that for a minute every day, just to get yourself used to that relaxation, maybe even before you go to bed at night. Now, thank you for listening. Do tell us what you thought. Has this information been useful? Has it given you an introduction to what we're doing? Follow the QR code on the screen here. Just make sure that when you click on the link to the evaluation, that form that will come up, that you click on the introduction video so we know which bit that you are evaluating. It won't take you more than a couple of minutes to complete that form, and we really appreciate your feedback. So that's all from me for now. So thank you, and hopefully I'll see you on some of the other webinars that we're going to be doing.